Good afternoon and welcome to the daily briefing at the EMA office where Chairman Kern is with us and Sam Behrman has our daily numbers. Sam?
Yes, so as of today, 71,208 St. Clair County residents have been tested, which is an increase of 794 from yesterday. We are at 6,421 for positive test results, which is an increase of 65 from yesterday. And that does include both males and females from under the age of 10 to their 90s. And our daily county positivity rate is 8.2% today. We are at 64,787 negative test results and 178 deaths for the county, so we are reporting no new deaths today. And for those who have completed the IDPH required 10-day isolation period, we are at 5,616. For state totals, 4,526,739 have been tested, with 253,690 positive test results, which is an increase of 1,337 from yesterday. And for deaths, the state is reporting 8,214, which is an increase of 30 from yesterday. For our hospitalization numbers, and the first set is for our hospitals that are in St. Clair County. Currently, we have 46 patients that are admitted due to COVID-related reasons, and 3 of those individuals are on ventilators. For our regional hospitalization rate, we have 90 patients that are admitted due to COVID-related reasons, and 9 of those individuals are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, we have 2 additions of cases today and 1 change. So the first is Caritas Family Solutions in Belleville has 30 cases and no deaths, which is an increase of 3 cases. The second is Lebanon Care Center in Lebanon with 72 cases and 12 deaths, and that is an increase of 5 cases. And finally, we have a correction to make. Colonnade Senior Living in O'Fallon. Yesterday, we had listed them on the EMA Facebook page as 7 cases and no deaths, and we would like to make that correction. They are actually 6 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. So we'll move into the zip code report at this time, and I think today we're just going to read the zip codes where there are changes. So we'll start with 62201. We go down 1 today to 226 COVID positives in that zip code. 62203, we go up 1 to 187. 62206, we go up 2 to 422. 62207, we go up 3 to 237. 62220, we go up 7 today to 495. 62221, we go up 3 to 602. 62223, we go up 1 to 370. 62225, we go up 1 to 29. 62226, we go up 2 to 664. 62232, we go up 2 to 176. 62239, we go up 5 to 91. 62254, we also go up 5 to 225. 62258, we go up 3 to 165. 62260, we go down 1 today to 118. 62269 goes up 2 to 503. And 62285 goes up 1 to 75. Our regional positivity today, according to the state of Illinois' numbers, is 9.9%. But as we calculate our rolling average, which is a 7-day rolling average in St. Clair County, we have our numbers at 6.8%. And today, the daily county positivity, as we calculate, and as Sam, I think, said, we've got 65 new positives today out of 794 tests. So that takes our positivity at 8.2% just for the day. The rolling average for 7 days is 6.8%. And then, of course, the states got us pegged in the region at 9.9%. A lot of numbers out there, Herb, but we're keeping track of all of them. And what I can tell you is I know the numbers that are done here, right here by the St. Clair County Health Department, by EMA and that Brian Whitaker pores over 24 hours a day practically, along with Sam, who puts all these numbers together. They're the most accurate numbers, so they're the ones that we really that we go by, and the ones when we talk to the state that we try to make sure they know the numbers as we see them.
Well, and I think it's worth letting our Team St. Clair followers know that, we're discussing every day with the state, with IDPH on these numbers, and as you said, these numbers that we're getting here are the most accurate from the health department, and that's why we give you so many of them out there. And I know sometimes it gets confusing, but there's a lot of the followers that got their own graphs, and they're making comments on there at night, and so it's really good to know that Team St. Clair is that concerned about what's going on. The number that we talk about all the time is that death number, 178 here in St. Clair County. There were some people on the page last night, talking about that small percentage, and we've talked about that. This is our 180th day that we've been doing this, and we've had this conversation before. One death is too many, and unfortunately, I don't want to be the one to pick and choose on who the next one is.
And if Team St. Clair hadn't gotten out there and slowed the spread, this is all about, if you think about it, if the spread had been stopped back in January or February, it never would have gotten here. We wouldn't have ever had to deal with this. And so what we've been doing this whole time is we're trying to isolate this virus in all parts of the country. We're doing our job here in St. Clair County to isolate the virus and keep as few people as possible from contracting it. Because if we don't do that, the death rate will continue to go higher. And what we've been doing all along is trying to keep this at a level where we don't see the kind of death rates that were predicted. And we're not through this thing yet. If we take our foot off the gas now, we might see those numbers. So let's just continue to wear the mask, wash the hands, watch the social distance, and we're making progress here. As I said, our rolling average, 6.8%, is the best it's ever been.
And it's something that the Team St. Clair should be proud of, as you said, because had you not taken the initiative to do that, and yes, we know there's some of you out there that haven't, and you won't, and again, that's your choice. Just remember we told you so, because a lot of people, as I mentioned earlier, there was a school teacher from Potosi, Missouri, 34 years old, passed away yesterday from COVID. Those are the stories that you don't want to hear about, and it can happen anywhere. I spent a good hour last night on the message with a young lady who is a recovered COVID patient, her and her husband, and terrible story. So it's out there, you just never know. But for 180 days we've been preaching this, and the mask was a big topic last night. One of our Team St. Clair members posted a article on there, stirred up a lot of interest, which is good. Sometimes good conversations is good. You will not discourage us from doing what is best for the public safety. We're going to post articles like that. As I've told people before, we've had physicians that came on these briefings and have sit here and said there hasn't been a one of them that says wearing a mask isn't a help. So if you don't want to wear it, so be it. But for those of you who have decided to wear the mask when you're out in public, watching your social distancing, washing your hands, thank you from the bottom of our heart for being a part of that solution. And for those of you that are part of the problem, I just hope it doesn't come knocking on your door, because we've showed you here for 180 days. We're going to be back with Cindy and Daisy to translate this into the Spanish communities, and then we'll be back tomorrow afternoon with our next daily briefing with more numbers. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask.
mask, gloves, soap, scrubs. No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper? Scrubs, soap, scrubs, mask, gloves, soap, scrubs. Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay